Okay, thank you all. Good morning, good afternoon, good evening, wherever you are, and welcome to this webinar on the right to health in times of genocide. It's an activity organized by the People's Health Movement, and the People's Health Movement is a global network of social movements, organizations, and activists that are advocating for the right to health. Also organized by Médecins pour le Peuple, and that's a Belgian organization of primary healthcare clinics and campaign centers, and by Viva Salud, and that's a Brussels-based NGO supporting the struggle for the right to health around the world. So just like all of you, during the last 9 months, we have witnessed how the destruction of the health system has been a deliberate tactic in the war on the people of Gaza, and also how the general health situation has deteriorated due to the lack of food, water, and sanitation. We've been all very active in solidarity activities. We've been expressing our solidarity with our colleagues and friends in Gaza, as well as with the Palestinian people in general. And throughout this whole period, it has given us hope to discover support and solidarity even where it's not always expected. Within the UN system, for example, the UN Special Rapporteurs have raised a strong voice against the genocide, and we are very pleased to have one of them among us today, and that is Dr. Tlaleng Mofokeng, or we can call her Dr. T apparently, Dr. T, who was appointed the UN Special Rapporteur on the Right to Health in 2020. She's a South African medical doctor and was a strong advocate for the right to health of the people of Gaza. A strong advocate also of the immediate ceasefire we all long for. And we're very happy that she found time for us today. It's Anna Vračar, one of PHM's co-chairpersons, who will take the lead in the conversation with Dr. T. You can ask questions in the chat box, and Anna can ask them for you if time permits. But before I give the floor to Anna, Dr. T, if you allow me, I would like to ask you in the first place how the UN is actually involved these days in the context of the war in Gaza. What are the UN and its agencies and also your office able to achieve in this context? Can you tell us a little bit more about that?
Indeed. Thank you for inviting me in this space. And I just came from Geneva presenting my report at the Human Rights Council 56th session. And I must say, you know, at the interactive dialogue with member states, I did start by saying to them that I have done everything possible, you know, with the mandate given to me by the council and through its resolutions, you know, with the working methods. And although I feel incredibly hopeless sometimes, I remain hopeful that we will have world leaders that can rise up still, even though they have shown incredible failure at the time of a genocide happening in real time, that they can still summon the necessary economic, political, and diplomatic power and influence to bring about, firstly, the immediate ceasefire, and secondly, the end to the occupation, but thirdly, some form of restoration and self-determination for the people of the occupied Palestinian territory. And so your question about, you know, what the UN agencies are able to achieve is very varied, because the UN has agencies, of course, that are targeted at and whose mandate are humanitarian response And we have seen incredible strength from those colleagues who have been working through those agencies. I mean, if you think about what UNRWA has had to deal with, and the kinds of attacks that they've had to deal with on a political diplomatic space, but also early on in this genocide, the people who were killed were our own colleagues who were part of the UNRWA. Even though they were local nationals, I still, thought of it important to signal that if UN agencies are not respected and the UN agencies and its staff are not receiving the required protection, what does it mean then for the everyday person? And this at the time was already, like many of my own colleagues, signaling that there will be worse things to come. In terms of the, what can be done. I mean, we've seen the UN the independent expert on the occupied Palestinian territory herself, Francesca Albanese, do some really incredible work. And the latest report to the Human Rights Council, was really, really important. The everyday responses that she's able to summon as well. But unfortunately, she continues to experience very targeted and very personal and completely out of order, the kinds of personal attacks she's receiving from those who are in various countries, in various territories, and unfortunately, without much support or protection. We know that the UN Independent Commission of Inquiry on the Occupied Palestinian Territory, including East Jerusalem, has found, right, that Israel authorities are responsible for war crimes and crimes against humanity in their report of June 2024. We've also, had other colleagues, for example, the Special Rapporteur on Food, the one on housing as well, together as myself, also as a combined effort, continuing to call on for an immediate ceasefire. And the experts at the UN who are independent, like myself, were some of the first to call this what it is, which is a power asymmetry, which is intentional, willful murder and attacks on civilians and a genocide. And so I think on the one hand, even though I feel completely frustrated and enraged by the inability of the UN Security Council, the General Assembly, to bring about, the required ceasefire, I am filled with hope by the work being done by people on the ground, and of course strategically. It's a difficult time because we see that even the methods that previously worked in these moments of crisis are seemingly not working now. So it's really a difficult time, but not a difficult time more than it is for the people who are living this horror of the genocide.
Thank you, Dr. T. And now just to touch upon something that you briefly also mentioned. Actually, in addition to the UN agencies, of course, we know that there's a host of other organizations who are there on the ground trying to reach people, trying to work with the UN and Palestinian organizations to provide healthcare. So from what you are seeing from your report, what is the conditions that these organizations are working in right now, facing the obstructions that you touched upon?
So as an occupying power, Israel has particular obligations under international human rights law to maintain medical and hospital establishments and those services, right? And also upholding obligations under international human rights law in the occupied territory in relation to the right to health in general. And what's important about the right to health is that it speaks not just about accessing health facilities, but it also speaks about underlying determinants of health, such as food, safe and potable water, safe, healthy, and working environments, which currently cannot be guaranteed at all by any stretch of the imagination currently under this grotesque violence. And so what we have seen is you have a lot of individual people who are helping other people through crowdfunding and through other methods like buying eSIMs that can be activated by people when they need them. And it's really been difficult to provide any meaningful support, because remember, the infrastructure and the destruction, the level of the destruction of civilian infrastructure has made civil society organizing really, really difficult, right? And so the targeting and the specific targeting as well of humanitarian workers does bring a chilling effect, which means that even those who wanted to help, who could get in and get the permission and the be granted the permission to enter Gaza, they may likely no longer do so because the rules have completely being broken with absolute impunity. And so it becomes really difficult to organize in terms of non-state actors, civil society NGOs. But we have seen the usual NGOs, the physician organizations. We've seen UN, other agencies supported by UN networks that exist for access. But when UN agencies themselves are unprotected and the workers there themselves are unprotected and unable to fulfill their own UN mandate, it becomes even harder for non-UN actors and non-state actors to provide that kind of really desperately needed support. But I must say, and I'm really grateful for the amount of activism and solidarity that does happen across social media, because we've been able to organize and connect with people in ways that without social media would have really, really been difficult.
And then, of course, one other thing that is happening on the international level is South Africa's case against Israel at the ICJ. And so, of course, this is something that, most of us as health activists have also been following, because the crimes against health are really striking. And we believe it, of course, to be something that is essential to this case. But maybe it would be nice to hear a comment from you. So from your position as UN Rapporteur, what does this case represent, and what effects do you think it might have?
There's a lot of skepticism around this from people, when you just speak to people about this matter, that, what will this achieve? Will this get us what we need? And again, when we are in the midst of this kind of mass killing and destruction, it's really hard, right, to imagine what process, if it's not leading to an immediate ceasefire, why is it even necessary, and why are we even putting time and energy into it? But I think this was important as a landmark ruling by the International Court of Justice, because it does offer the first concrete hope to protect civilians in Gaza. I know there's been a lot of criticism about where the court could have gone a bit further to articulate particular things and to make particular judgments. But I think it is a significant milestone in this decades-long struggle for justice by the people of Palestine. I'm still disappointed that the ceasefire is still not being achieved despite all of this. But I think when you are thinking about the level of impunity that Israel has been able to exist with, right? This case was important, if not now, but definitely for the future of Gaza and its people. And again, what was good about this is that the court dismissed, right, Israel's justification of its actions as self-defense. And this is important. It was important to re-articulate that, right? And that the court found that Israel cannot continue to bombard or displace or starve the population of Gaza while allowing its officials, even the settlers, the court didn't say this, but I would even say the settler population, to continue to dehumanize Palestinians, right? Through statements that at the time the court was saying may amount to genocidal intent. But we have since, of course, progressed, and the court has had different submissions by South Africa since that first time they appeared. the fact that these have gone beyond just genocidal incitement, but have actually gone to being actual acts of genocide. And I think it's important, about international humanitarian law, for example, about how it prohibits attacks on civilians, right, and non-combatants. And when you look at the number of healthcare workers that have been killed, if you look at the number of journalists that have been killed, and of course, the civilian population, many of those are women and children, even including men, people with disabilities. If you think about the unquantified people who have died and perished and are still lying under rubble, it shows you just how completely the Israel government has really gone beyond what any of us, I think, was possible in terms of contravening and really distracting and causing such war crimes, right, and committing this genocide. And I think what was important as well was that the case brought about the element of prevention, right? And what I was hearing through people talking and discussions in various circles and sittings, it's this obligation to prevent, right, a genocide, and that member states of the UN have failed to prevent a genocide. Various multilateral processes have failed to prevent ongoing escalation. And so this case, I think, for me, has opened up a possibility for people to actually find justice and to seek justice even within their domestic courts. Whereas before this case, a lot of what was seen as justice was often limited to Israel saying, well, we will investigate ourselves, we will do some report back, and we know the investigations never happened, but how objective will they be, right? Even if they did happen. And so I think this has allowed people who, for example, feel that their own countries in the European region, of course, the US, have aided in this particular genocide and these war crimes, and that they can hold their own leaders accountable through domestic measures in ways that before this we didn't think possible, we couldn't see it possible. And so I think justice will come, and it will come in various ways. And if it means it will come in different bites, in different directions, up until we get to the center and to the heart of the beast, then so be it. But we have to start somewhere. And I think the court case is important in that instance, that it gives us right now new articulation. It gives us, affirms, right, the rights that many of us are committed to, many of us know. And it does so through the International Court of Justice, as opposed to just academic papers or opinion pieces or press releases that many of us write, and that this is coming from the court, even though we may feel, some of us, that the court could have gone further, but it's still important in terms of what it has done, in terms of what it has articulated, in terms of its findings.
And of course, I think it's also very striking to hear how you talk about your own frustration, because I know that for many of us in the health movement right now, it's been months of joining initiatives, of joining BDS groups in our countries, of joining local solidarity groups, but somehow people cannot feel but frustrated because sometimes they feel that all of this has really very little impact on the ground. And of course, it's difficult not to think that way when you see the recordings every day. But essentially, still, I think we'll agree that keeping up with the solidarity in different forms, as you have said, is very important. And I wanted to ask you if you could reflect with us on some forms of solidarity and engagement for health workers that can be effective in this context.
In terms of health workers and what can be achieved, it's been really, really, really tough to exist in this moment where, and early on I called this the worst time for the right to health in our living history, in terms of all of the different ways that the right to health has been attacked. And to be honest with you, I have been turning down some interviews, right? Because I feel like I've said everything that there could be said about this, and I'm appalled, I'm horrified, I'm angry, I'm raging, I'm furious, and completely depleted and exhausted, mentally and emotionally. And what gets to my gut the most is understanding that this isn't even a fraction, it's not even a percentage of what the people who are living under that besiegement are going through. And to be a health worker as an oath taker who chooses not to leave your patients, and then you get abducted, you get humiliated and beaten and tortured, and some of my own colleagues have been killed, right? While imprisoned, while in detention without any charges. Others have been released recently. Others we still, cannot account for. It does really feel like a ripping out of the heart. And so I have just no words of to offer in terms of this situation, because at this point the amount of destruction that Israel is responsible for means that there is no life to speak about, because the conditions conducive to a life of dignity don't exist in Gaza. And so how do we even then start to talk about, the insufficient medical supplies, the fact that doctors are unable to deal with the devastating complications of the injuries from war, right? Repairing of fractures, controlling bleeding, and also just dealing with all of the other chronic medical needs as well. A lot of people are dying, and not from war injuries, but untimely succumbing to their chronic illnesses, which cannot be managed. So it's really a tragic time, and in terms of mental health and the emotional toll this has on healthcare workers, it's quite immense. But on the same note, I will be writing a report next year to the Human Rights Council and General Assembly, focusing on healthcare workers in humanitarian and conflict settings. And this solely has been inspired by this unfortunate escalation of violence that has been going on for decades. But I want us to start thinking intentionally about healthcare workers as the human rights defenders, and start to advocate for them and organize around understanding how crucial they are as human rights defenders, both in times of conflict and non-conflict, in humanitarian and non-humanitarian settings, because we understand freedom of speech and journalism and that very easily, right? And there's a lot of organizing and resourcing and funding of organizations that support freedom of speech and journalists and their own rights as journalists to do their work. And I think by the same understanding, we should start to think about the practice of medicine in this context that we see as in itself a protection and a promotion of human rights, but specifically the right to health. And so by taking into consideration a lot of what has gone wrong, I hope to bring a human rights analysis, but also through the obligations that states have, articulate in some way how we can do better for these really important individuals who take the oath, who are the last to leave, and who often always pay the price with their own lives, and also their own families, who suffer from not having a dad or a mom, with them, even though they still choose to stay in the hospitals and serve their community.
And of course, over the past 7 months or even more, So we heard horrifying stories coming from health workers, including the directors of some of Gaza's largest hospital, Al Shifa. He was released a couple of days ago, but then we hear the accounts of the conditions that he faced while he was in prison. We also know of partners of the organizations who have helped organize this conversation. So Viva Salud, where the director of Afga Hospital was also taken by the Israeli occupying forces very early in the war. And so from what you are saying right now, would you say that documenting these kind of cases, documenting the attacks on healthcare, documenting the testimonies coming from the patients, does that play a role in a path towards justice later on?
Absolutely. It is important, and the UN as a system is very bureaucratic, and clearly not enough internal systems and capacity to react in real time to disasters such as a genocide. And I think one of the most important moments of reflection by the entire UN system and the different ways and mechanisms it has at its disposal, it's to really understand what can we do if we are unable to stop a genocide in real time. What kind of leadership do we need? What kind of mechanisms do we need to build into the system to ensure that we can respond adequately, timelessly? Because remember the genocide that's happening in Gaza. A lot of us are also working in other really dire situations, such as the conditions and the crisis happening in Sudan, the crisis and the situations in Myanmar, right? So there's a lot that the world is grappling with in terms of conflict and protracted war and its impact on the right to health. And what has been frustrating is the inability to respond in real time. And we must, of course, all of us, do everything that we can to support each other across different advocacy moments and advocacy strategies. And if it's divestment, if it's boycotting, whatever it is, we need to do that. If it's sanctions, we must do that. We have different methods, for example, as UN experts, to also write in an urgent appeal to member states, to non-state actors, and that process becomes confidential for a few weeks, I think about up to 2 to 3 months. But a lot of what we have done does become public, like the urgent appeal I sent to Israel on the 4th of December became public in the new year, I think in February. And there have been others which are the same, which because of the ways in which that method works, we aren't always in a position to discuss them publicly. But one of the things that a lot of people have been talking about, it's sanctions, is divesting, and it's boycotting. A lot of the arms manufacturers, a lot of the private companies that are supporting the war through, of course, production of arms. It's important to also think about those companies and their role as business, right, in a genocide, and reminding them of the UN guiding principles on human rights for business as well. So it's very important that all of these strategies connect to build one large movement, and we should see it as such, that there may be ways we wish the UN could move on and they can't, but what other ways can we strategically move other actors and other people who are in solidarity, who can particularly do things perhaps that as an independent expert I'm unable to. And so we move, and what are things in academia that can be done, diplomatically, economically. So it's very important to think about them as a whole, as opposed to thinking about how the UN is failing in one instance. But let's think about what it is doing and how is that what it's doing can be used, right, as a building block or a stepping stone that others can also use in, in other ways to demand more justice. And immediate ceasefire for me is what's needed right now. And I'm still doing everything in my power to get that, because under the prevailing context, not much can be achieved. We do need that immediate ceasefire. Really, that's really the bottom line. We need that. But in the interim, we should still make certain demands and move forward in the different ways that we can organize.
And would you say that health workers around the world can play a particular role in this? So are they able to bring any kind of specific approach or specific knowledge that is needed for this kind of documentation and support of processes that are already in place?
Absolutely. And the documentation is important because, we don't know what the future holds. And often, I say to people, we have to do this work not just for us today, right? But think about the people in future as well, who will look and wonder, what were those people thinking or not thinking, or why was this done in this way and not in that way? So in different ways, I find that the recording of what's happening is important to get to justice, but it is also important for us to humanize ourselves as people of the world who know what oppression is, who know what colonial power does, who know what imperialism does, that we keep humanizing ourselves. And so that's why I think of us documenting what's happening, not only in terms of the violations, but documenting the joy, documenting the poetry, documenting the dancing and the singing of children in the streets of Gaza. That is a form of resistance when everything around you is designed and funded to literally kill you and suffocate you every day. And so your ability to find hope and remain hopeful in this circumstance is important. And I think as much as we document the violations, I'm also very intentional about humanizing the people of Palestine in the context of this global movement and agenda that's very targeted to dehumanize them. So even in the ways that people are spoken of, even the way that news media covers a lot of these stories, it's still very problematic in the language that they use as well, and the kinds of photographs that they choose. So it's important to do both. And of course, the UN, through different mechanisms, has online portals where people can submit allegations of either past, ongoing, or current human rights violations. And those, depending on if it's just relevant only to the right to health, it will get channeled to my mandate, and therefore I can have the allegation. I can write to the state involved, require more information with the necessary consent of the people. And so on my end, for example, that's how the health workers and what they are going through can be used. It can be used for me to write to Israel to say, look, I've received this information. Please, may you give us more. I've done the same when different health workers were abducted. And remember, the right to health has been engaging with the state of Israel even before the 7th of October, constantly appealing for them to give permission for children and their parents and caregivers to move out of the strip to get better care. We've been appealing to them, even during the COVID pandemic, to remember their right, their obligation as under the right to health as an occupying power, right? So we have a track record of engaging with Israel as an occupying power. The responses vary differently depending on what you are discussing, but it is important to document those and really look at them not just for the moment, but also for future, to enable possibly justice and reparation in the future as well.
Thank you. And I would now like to move us a bit towards the conclusion of the conversation. Maybe maybe by touching upon some of the questions that we received. And essentially, so what some of the participants are asking about is a bit more about the role of the UN rapporteurs can play in the future when we continue talking about Palestine. So what kind of action can you take based also, of course, on coordination with the civil sector? So is there a kind of dialogue between the rapporteurs? Is there consensus on this topic? Are there some joint actions that can be taken and that maybe we as activists can support?
Yes, there has been joint action by mandate holders. We continue to release publicly press releases so that the public rights holders, all of you, are kept updated, firstly in terms of the contextualization of what's happening, so that you understand and get a coherent viewpoint from special rapporteurs and independent experts, and also get to understand what it is that we are demanding and the call of action that we are making. I, for example, have been taking joint action, sometimes led by the independent expert on occupied Palestinian territory, Francesca Albanese. Sometimes I take my own action as the expert on the right to health on my own, and sometimes she joins me. We've had joint action with the Special Rapporteur on food and housing, especially at those moments when the issue of not letting through food aid, and we really realized that what was happening was that starvation was now being used, right, as another weapon of war. We did a joint action together. We do, against, write and appeal directly to the member state. So we do engage directly with Israel. Whether they respond or write to us, that remains our prerogative, right? We can't force them to engage with us. I independently wrote to the High Commissioner. I wrote to the UN Secretary General, Antonio Guterres. I also wrote to the President of the General Assembly at the time, highlighting to them different roles and different responsibilities that they have within the multilateral system, and appealing to them to do everything in their power, right, to firstly articulate the issue properly and contextualize it, not as a symmetrical battle between two military units, and to remember that this is a decades-long illegal occupation, and that in fact liberation is everyone's right, and so resistance to an occupation is the right that Palestinian people have, and also reminding them that an immediate ceasefire is important, because in the prevailing context of violence, where even the UN Secretary General himself cannot guarantee the safety of his own employees, we have a very, very big problem when another UN member state is making the conditions such that even the Secretary General is unable to secure the safety of his own employees and cannot fulfill his own mandate through the different agencies on the ground. That is a complete and utter disaster. And what I still find incredibly disappointing is that you have reports that this has been a war that we've seen the most of our own UN colleagues being killed. But where is the fury and the rage within the UN building about this? Where is the call for an independent investigation, consistent one, right, that pushes politically and diplomatically to make sure that the UN can gain access to do this kind of investigation, to ensure that the UN and the important supporting agencies and, for example, experts such as myself and Francesca can gain access to those detention centers where a lot of the Palestinian children as well, including adults, are being kept in detention without any charge. So for me, it's just the lack of visible, demonstrated rage and fury, at the level of how much the UN itself has been made incapable of fulfilling its own mandate. And I think it's that lack of a display of really just, for me, I don't understand how we can just carry on as if life is normal and there's just this one problem happening in Gaza. I'm like, this is not just a one thing around Gaza. This is a big global issue around what illegal occupation can and enables, and what imperialism does and enables, and the level of impunity, but also the level of enabling and the level at which the America, for example, has been giving aid in literal dollars, but also in arms, has been completely unprecedented, right? So what are we saying about all of these things? And for me, it's just, I don't think we have the world leaders that we need, to be honest with you. Never mind that we deserve. We just don't have the world leaders we need, period. And I wish for a moment in time where we can have the leaders who can rise up to what this moment requires, both in terms of ethics, in terms of dignity, in terms of strategy, and that we can once and for all people around the world, understand that when Palestinian people are fighting for justice and for their right to self-determine, that is a fight. And when they do get justice, when they do win, it will be a win for everyone everywhere who's occupied and knows the crushing weight of occupation and imperialism. And so this is both a literal, physical battle, but it's also very much a political one as well. And as a person who grew up in apartheid South Africa, who was a child at the time, and whose core childhood memory is protests and running away from military vehicles, I share a lot with those children in Gaza. And I may be an adult now and a child who survived all of that. But I know on a philosophical level, this is an important issue, and viscerally as well. And no one has to convince me that this was always going to end up this way, which is why some of my early interventions were always about warning. If you don't do anything right now, you are going to get a situation where you have enabled even more violence, even more than we have seen before. And indeed, we are living in a genocide. And so I think the inability as well of world leaders to understand those early warnings and take them seriously is another showing for me of a failure of leadership on a diplomatic, political level, on a global scale, of leaders everywhere who have failed all of us.
Thank you. Really, thank you. I think that in the People's Health Movement and in the other organizations that are here, we definitely did point to the complicity of the West nations in particular when it came to the relation, to the approach to Palestine and to the communication with Palestine even before. I'm really glad to hear it put from you in such a strong way. But maybe just to draw the conversation to a final conclusion, I'd like just to use another question that Leonard has put here in the chat. So it's a difficult one because I think it's something that we ask ourselves every day. But it also gives maybe some room for us to think after the interview as well. So how would you say that we as movements outside of Palestine, how can we contribute to supporting the right to health there? Can we contribute in any way to protecting the right to health of the Palestinians and to stand in solidarity with them?
Look, the activist in me says we have to keep protesting. We have to keep making our own leaders uncomfortable on the domestic space, right? At the fact that there is a genocide that is ongoing, and asking for what it is that they are doing. if you are South African and you live in South Africa like me, the kind of protest action you would do would look very different, right? From a country, if you lived in a country that is supporting this occupation through military or aid, right? And so I think the protest and the organizing and holding our own governments accountable where we are at is really, really important. The civilian infrastructure is such that it's completely distracted. I mean, even before October the 7th, I keep telling people that, it was still very difficult. It's not like you could just walk in and out of Gaza before on October 6th. You could not. It was already a humanitarian crisis. So any imagination that says to us, get a ceasefire so that we can go back to October the 6th is also still not understanding what was going on in Gaza. Even before October the 7th, you couldn't just send stuff through Gaza and you know what I mean? It was not as easy as that. And so with this complete destruction of civilian infrastructure, for me, what I have seen, if you wanted to support people, is to find ways to send them literal money that they can use to get resources. I've seen a lot of people come together at a community level in the strip, cooking, making sure that they can get some kind of supplies, find, UN agencies like UNFPA, for example, who are doing dignity packs and menstrual hygiene support for people on the ground. They've got the pregnancy kits as well. That's really helpful for people who are pregnant. Find other agencies who perhaps already have a footprint and a network in the area to try and support your work. But one of the deliberate and intentional things that Israel did was ensure that the people of Gaza are as isolated as they could be. And I think that's also intentional. The fact that it's so difficult for us to provide what we think is tangible support is very, very intentional on their part. And so I would say find credible non-governmental organizations who are working in solidarity, write to the mission. If you have a Palestinian mission in your country or in the region where you are, get guidance from them, who are the real and credible organizations that you can connect with. But I know that it's really, really been difficult. But through social media, there's a lot of people who are crowdfunding and raising for different causes. And I think it's about linking yourself and plugging yourself into those kinds of networks as well. But it's very difficult. And I know a colleague of mine at the UN who works on foreign debt and human rights, Atia Waris. She's an independent expert there. She's been looking at the financial system and how that in itself and the way it's organized is problematic as well. So even sending money through bank accounts is not as easy as we just take for granted that you have someone's account and you send them money. It's proving to be very difficult, but it can be done. But it does need a little bit of tenacity to do that.
So thank you so much, Dr. Tlaleng Mofokeng. It's very powerful, and you talked about a lack of rage and fury in some circles, but among us, we share your rage and the fury. Definitely, you can count on us. But on the other hand, what I will remember and what gives hope is one-liner, something you said, and that's that justice will come, and justice will come in various ways, and it will come in bits and pieces. It will not come just all at once, and we can contribute to this justice. So that's, I think, a message that really gives us also hope. So thank you for being such a powerful voice for justice. And it's really good to know that we as activists, as grassroots activists, also have allies in positions that probably we don't even know, like in this whole UN system that you described. So that gives hope, and it also challenges now to turn our anger in a positive force of solidarity in order to bring justice and also accountability and restoration. So let's discuss this in our own circles and organizations now. And I've seen that we have people around here from all the way from Australia, from Asia, including West Asia, from Africa, from Latin America, North America, from Europe, of course. So we have people from all over the world, and I know that people who are here will re-echo and will spread this message also around them. So that's also a source of hope. So as we already said in the chat, the recording will be posted. We'll post it on the PHM website. And I propose that we will also write just one message, one email message to everyone who registered, so we can provide you with the link. I felt a lot of very, very powerful energy, and I'm sure this will not be our last conversation. So thank you so much. Thank you once again, Dr. Tlaleng Mofokeng. Thank you to all the participants. Thank you, Anna, for helping with the interview, to Miguel and Candelaria and Marita, who were here behind the scenes to help with logistics and with interpretation. Thank you all, and we'll be together in the struggle for health, even in these times of genocide.
So I think I will end with just to say that indeed there is a lot of solidarity from many different spaces, and mine comes from definitely being a South African, but also being a medical doctor and understanding what it means to take care of your patients every single day. And I think what I'm now paying attention to is the immediate mental health support around trauma, but also the long-term support and what that would look like when we rebuild Gaza, because we will rebuild it. Evil, even though it seems to be thriving at the moment, it does come to an end. And when it does, we need to all be here and be ready to support and to rebuild Gaza, and to do this for its people and its children. And we know that this war and its impact will live for a long time. And for many of those children and people will be a lifetime. But I know that in our approach to substantive equality, questioning power, and really being intentional about reparative justice, that we will get to a point where the Gaza people are not just about surviving, but about thriving. And you can count on me to always be of support to that mission of justice, of reparation, and of ensuring that the right to health is realized for everyone everywhere in the world. And that indeed I will continue to do everything in my power to achieve an immediate ceasefire, to ending this occupation, and to really demand a reimagination and rearticulation of what we want as a world, as a future of Gaza, where the people of the occupied Palestinian territory can self-determine, can be given space and time to determine for themselves what it is that they need. And we should remain ready to provide them whatever the resources that they require for that space and for that place where they call home. And we should all be committed ultimately to ending imperialism and colonialism where it exists everywhere in the world, in all of the structures in which it exists, because it reinvents itself in many different ways. But again, you can count on me for that ongoing solidarity and that unwavering optimism and hope that indeed justice will come, and it will come, and we will be ready to do right and to do the right thing. Thank you so much.
Okay, that's great. You can count on us, on the People's Health Movement. So have a nice evening, and probably we'll meet again sometime in the struggle for the right to health.
Absolutely. Thank you so much. Thank you,
Thank you.
everyone.